back. This is Boomer Life on CL 650.
Welcome back to the program. Sterling Fox with you. Joining us in studio from Neurokinetics Clinic here in Vancouver is Philippe Silvestre and Sonia Dale. And we're talking about the brain and what can be done for those who have suffered a traumatic brain injury. Neurokinetics Clinic treats concussions, trauma, disability, pain, and injury. And, of course, it's ever so timely that you would pop in, you two, for a visit because March is Brain Injury Awareness Month, and that is not only here in British Columbia, it's right across Canada. Philippe, is there any difference between a concussion and a brain injury, or are they, in fact, one and the same thing?
Well, one belongs to the other. Concussion is a modality of head injury.
Okay. We see a lot of concern now in sports, and some of the professional sports associations, both here and in Europe, paying more attention to injuries, concussion injuries. And now we see more and more of that focus trickling down to children's sports. Do you think that that is a smart focus? Should we pay more attention to children when they sustain head injuries, even when playing against other children? They're not going to be as severe as maybe an adult would get, but on a comparative level they are. Is that a good focus? Is that a good concern?
Certainly. The reason is when a kid gets hurt, his or her lifetime to come may be compromised as a result of this head injury. So the stake is greater for a child to be hurt or wounded or disabled even temporarily compared to an adult who has already half, one third or half or more of lifetime behind. And also the capacity to repair for kids is greater than for adults. So altogether you have parameters which make every one of them unique. So we talk about age ranges rather than child or adult, etc.
But you do treat, Sonia, you do see children at Neurokinetics, don't you?
That is correct, yes, we do.
And what sort of typical brain injuries, are they always brain injuries, or are there other types of serious traumatic events that cause people to come to Neurokinetics as well?
No, there's various kinds. It's not just we do focus, however, on the brain, but we do have other injuries related anywhere from the pain all the way up to short-term, long-term disability. They can come in for pretty much anything that relates to pain and trauma in their life. Okay,
and that would include chronic pain, Philippe. For example, you sustained you were in a traffic accident 5 years ago, and it's never been the same since. And you've been and you've seen chiropractors and you've seen the family doctor and even tried that acupuncture once and nothing worked. You've never been right, and it's been over 5 years. They come to you. Walk us through the process. When a person comes to you at Neurokinetics and they have this kind of either chronic, constant pain, or there's an event that has caused a brain injury, walk us through the process of becoming a patient at Neurokinetics.
Well, the first thing is to understand what is going on. So we have a thorough investigation, and actually my background encompasses a training as investigator and forensic medical investigator. So it is necessary to understand all the ties and what are the cofactors, for example, and key parameters to allow someone to be stuck in a given place, for example.
Right, and you talked about in our last segment about your work in the outdoors and observing all sorts of adverse conditions and noting all of the observations. So clearly you are, there is an academic approach to the assessment, correct?
Correct.
So how long, Sonia, would it take? Suppose someone comes in for the very first time.
Right.
They've heard us on the radio. They know someone who would be a prime candidate. They call that person and say, there's a place where you should go. So when that person either calls you or just shows up, what happens?
From that point forward, we go on to basically what we call a consultation. Which is anywhere between about 15 to 30 minutes in time. It's basically getting a brief run through or brief history of what they are going through, what they're suffering through.
Okay.
At that point forward, we will actually move on to, if they are comfortable to move on forward, we will at that point move on forward with their assessment stage, which is where we go ahead and do the assessments. It's a triage, so there's three assessments. First one, we do the testing, come back to the consultation room. They will then, at that point, get all the data that's collected from the assessment, do a run through with Dr. Philippe, and he will go ahead and let them know that yes, you can move on forward, or no, you cannot. From then, we go on to level 2 and level 3. Those are our other 2 assessments.
Is it helpful when people come to you for the very first time? Now, these are people who have been through the mill.
Yes.
They've been to umpteen doctors and therapists and Lord only knows who else. So they have probably accumulated quite a bit of information about themselves. What, Philip, would be useful for a person to bring with them on that first initial appearance at neurokinetics?
This is a very good question, because we actually ask people, we recommend and we require sometimes people to come with whatever they have at hand to start with, including medical history, current treatments, or former treatments, if they remember that, and whatever, and what have been the kind of nature of interventions in the past,
right?
Whether surgery, whether psychiatry, whether you name it.
And another thing that I noticed when trolling through the website, Sonia,
yes.
and this caught my eye.
Yes.
And I know this because of previous interviews I've had with personal injury lawyers.
Yes.
I've learned a lot about brain injury from the lawyers and their side of it all. They tell us, and it's on your website too, when a person with a brain injury comes to neurokinetics for the first time, it's probably a good idea that they bring someone with them. Because in many cases, a brain-injured person is not the best individual to assess his or her condition, because you'll say, so how you doing today? I'm fine.
Yes.
I feel great. No problem at all. And you look at the person that came with them and they go, she's not fine.
Yes, that's correct.
So that's handy too, isn't it, Philip?
Absolutely. It's necessary.
So you would recommend that again. Show up with someone important in your life that's not going to tell stories on you, but it's going to be your advocate, your ally in this process.
That is correct. So when they usually do call in, or they send in an email, for example, as an inquiry, I do recommend that they do bring in someone. And it's usually somebody that they feel comfortable with, whether it's a family member, whether it's a friend, it could be anybody in their life. So yes, they do bring in someone with them.
Okay, and so one should, for that first session, Dr. Philippe, one should expect to spend how much time on that on day one? They bring along a little dossier with some medical information from their previous experiences, which they hope is helpful to you. They show up with a friend or family member. And how long should they expect to be at the clinic on that first day?
So this is a very good question. First of all, we have a sort of introductory time together. And for people who cannot be local, but are flying patients, for example, I must mention that we are essentially a destination clinic. A lot of people are flying in from the four corners of this planet.
Right. I should probably have mentioned that myself, because
yes.
it's a big part of what you do.
Yes.
You are perhaps even better known beyond Vancouver than you are here.
Yes.
And you have a lot of patients who come to you from points very afar.
Yes.
Okay, so now let's talk about a Vancouver person, though.
Yeah.
On that first day.
So if that person is in driving range, we recommend that person to come with a friend or a spouse or a guardian. And we basically discovery time. Discovery time will take up to 1 hour.
Okay.
We provide this very kindly for free, because we think that before engaging into the assessment process, which is extremely demanding, we want to make sure we have serious strengths to rely on before committing in time and money for both parties, actually.
So the first consultation is free.
That is
and it's a two-way street, isn't it, Sonia?
Yes,
Not
it
only
is.
do you assess whether you're capable of helping this individual,
Yes.
but it also gives the injured person an opportunity to determine whether he or she might benefit from sticking around and going through the program with you. So there really is assessment on both sides, isn't there?
That is correct. And actually the main reason why we do the consultations is if you're coming in and you're going to be working side by side with a doctor who's going to be treating you, my thing is, and I always let the potential patients know as well, or existing patients, they have to feel comfortable. That's the main key thing, is whoever you're getting treated from, you have to be comfortable. So that's why we do the consultations, and we do it for free, is they should come in, feel for the environment we have in the clinic, feel how Dr. Philippe is, see how I am, see if they feel comfortable, and move on forward.
Well, you're certainly both very approachable people, to say the very least.
Thank you.
So when you have these, now, most of the people that come to you, Philippe, are most of the injuries specifically brain injuries?
No, it's more than that.
Okay.
Before engaging on this, Sterling, I would like to complete for the people who are not local. I think it's important also to know what we can do for them.
Sure, because we're all up and down the east coast of Vancouver Island, like a local radio station. So all those people who can jump on a ferry and come across, go ahead, please.
Well, the good news is they don't have to do that. We can proceed through Skype.
Oh, okay. So you can do that initial consultation on Skype?
Absolutely.
Okay.
And that will not need to be physically present at the clinic.
Ah, so you don't have to necessarily pay the enormous ferry cost just to come over and have a howdy-do. You can do that on Skype and save your money for when you need to get the work done. Right?
Exactly.
Well, that's great. That's a nice service to provide.
Yeah, and we love it.
So after that initial consultation, you've had an hour of getting to know you, and both parties decide, we could get some traction going here. We could get something happening. What happens after that? What's step 2 once the initial decision that you would like to accept this individual as a patient, and that person decides this is the place for me? My gosh, you wouldn't believe how many others I've been to. Thank goodness I found you. So, okay, now step 2. What's that?
So step 2 is a consultation, is a session, is no longer a consultation. It is a session which includes investigation, examination, and test. And the tests we use are based on a blend between Western medicine and Oriental medicine, as well as neuroscience and the state of the art of neuroscience. We proceed with part of our test in a sensory deprived environment, which is a black room, basically.
Okay.
Which all parameters are computer controlled, and it allows to understand what is the state of brain functionality. So now we are getting to the brain stuff.
Okay. I wondered, though, if a sort of a byproduct, if you're not dealing with someone, Sonia, who's brain injured, but someone who has chronic pain, living with chronic pain over an extended period of time can really harm a person's psyche. So not only do you have the physical problem, but you also have years and years of living with chronic pain, which can produce a pretty dark outlook on life. It can lead to depression and a few other things. So is part of the assessment process both the physical and the psychological health of the individual?
It's getting to, correct, that is correct. It's getting to know the patient one-on-one. So getting to know as much information as they can provide us. At the same time, it's letting them know that we can only help them if they allow us to help them.
Right.
Meaning if they give us the information, yes, we can go ahead and help them with that information. And it does take, we do understand it does take a little bit of time to have that comfort and to open up with somebody, especially somebody who has the anxiety and the depression and the trauma related in their life, related to pain or related to anything.
Well, and I suppose also, Philippe, if you've gone around and around and around the block and you've been to every practitioner west of the Alberta-BC border, you have enjoyed absolutely no satisfaction, Lord knows how much it cost you, and you still feel terrible, well, then you go see this new guy, and chances are you're going to be a little cynical because you've seen these so-called professionals in the past, and they didn't do a darn thing for you. So you're going to have to break down a little bit of that cynicism too, aren't you?
Totally. This is one of the essential challenges we have, which only ties with the difficult journey and the bumpy journey those patients experience and one would experience in similar places. So what we do is basically we disarm the bomb. And the best way to disarm the bomb here, a way to speak, of course, is that we ensure that the patient understand everything that was done to them was done ethically, in all good faith, with all good standards, professionalism as required.
By the previous practitioners,
by the previous practitioners.
Sure, okay.
It is necessary to reset the clock on a nice way.
Interesting, though, that the guy who's formerly in the Air Force would describe a change of attitude as disarming the bomb. But that's because there's a lot pent up in there, isn't there?
Exactly. And, those patients turn into accumulating frustration and anger.
Oh, yeah.
And deceit.
A lot of baggage emotionally, right?
Lots of baggage. And it is only a normal outcome. So when we explain that this is totally normal, there's nothing wrong with that, and if they wouldn't be so, they wouldn't be human beings.
Right.
Then we begin to see some smiles lighting the faces.
Ah, because there's understanding of the degree of frustration that years of searching and attempting to get things fixed unsuccessfully, that leads to an enormous degree of frustration.
Exactly. And communication is everything.
Mm-hmm.
Communication allows to listen to the patient, and allows to the patient to listen to us. So we set that two-way street, which is necessary for the success of the whole operation.
Okay, so that's step 2. Need to take a quick break here. We'll come back and talk more about neurokinetics. Our guests in studio, Philippe Souvestre and Sonia Dale from Neurokinetics, which, by the way, is on Granville Street in downtown Vancouver. It's in the Highcroft Medical Building, and that's at 3195 Granville Street, Suite 60, if you insist. And online, by the way, at neurokinetics.com. Back with more on Boomer Life right after this.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on CIL 650.